also working the latest on the Ebola outbreak. An unnamed patient receiving treatment at Atlanta's Emory University Hospital for the past month has been released.
This as the Centers for Disease Control announces stricter protocol for healthcare workers who treat Ebola patients. Eyewitness News reporter Shantae Lands live in studio with more.
Patrick and Danielle, federal officials now say all healthcare workers should be covered from head to toe when treating Ebola patients. These new guidelines are only recommendations and come as dozens of people being monitored for signs of the virus have passed safety tests. This morning, 260 people in the United States continue to be monitored by the Centers for Disease Control for Ebola symptoms. The agency issued new steps yesterday to ensure that no more U.S. healthcare workers contract the virus. Among them, healthcare workers must use protective gear that leaves no skin or hair exposed. They must also use a respirator over their face instead of just goggles. Now, the CDC last updated its guidelines for Ebola treatment over the summer. Agency officials now admit the infection of the two nurses who treated Ebola patient Thomas Duncan proves they were inadequate. While it's still unclear how they contracted the virus, health officials say the greatest risk lies in how they remove their protective gear.
If there is some sort of fluid on the front of that gown and you take it off and come in contact with it, well, that could be a very deadly mistake.
One of the critical aspects of these guidelines is a very structured way of doing that, step by step, which is supervised and, in a way, ritualized.
And now a trained monitor must supervise workers putting their equipment on and taking it off. Coming up new at 6:30, what's being done locally here in the Ocean State to keep nurses and patients safe? Live in studio, Shantae Lands, Eyewitness News.